Be mindful of everyone's time. So we're going to go ahead and get started. So thank you to everyone for joining us tonight as we round out our series for Minority Health Month, which was for April, and we're trickling over into May. We're hoping to create opportunities to raise awareness about the health problems facing racial and ethnic minorities and disparities in the health of different populations. And we are so thankful that you guys are here tonight to learn how to move the needle. We have a special guest, Miss Jeanette Baker, will be joining us tonight with a presentation. We're very excited to have her tonight. Just as an FYI, the webinar tonight is being recorded. If you have any questions, please feel free to use the chat or raise your hand. We will have a time for question and answers at the end of the session, but you're of course more than welcome to drop any questions or comments in the chat throughout the program. So with that, I'm going to go ahead and turn it over to Barb Baptista to make our introductions.
Good evening, everybody. It is my very genuine pleasure to introduce you to Miss Jeanette Baker. And for many of you in attendance, she is a familiar face. Miss Baker is a Fernandina Beach native. She retired in 2009, and slowing down is not on her vocabulary. She retired as a consultant with the Division of Disease Control with the Department of Health in Tallahassee, and her position allowed her to be involved statewide with many projects with quality improvement for HIV and AIDS and AIDS clinical sites, protocol development, and technical assistance to a number of providers across the state. Jeanette's activity included international volunteer work with the Global Medic Force and working with the Clinton Foundation. She helped to successfully organize and implement HIV, AIDS, antiretroviral medication adherence and prevention in Cambodia, Lesotho, South Africa, Suriname, South America, Nigeria, and the list goes on and on and on. And she her first retirement was as a major with the United States Army Force. Thank you, Ms. Baker, for your services. And during their time, she served also in several countries. She is currently, or has been, the executive director of a community-based organization that most of you are very familiar with, the Coalition for Reduction and Elimination of Ethnic Disparities in Health. And it's known as, for short, for CREAD. The mission of this organization is to educate the community concerning chronic and infectious disease, especially HIV and AIDS, their signs and symptoms, and the importance of testing and early access to care, which relates to so many of the chronic conditions that we all are constantly talking about. She has been dedicated to youth education, and her philosophy, I think it sums it all. It's better to live your own destiny imperfectly than to live a limitation of somebody else's life with perfection. So with that, I'm going to turn the video to Ms. Baker, and thank you, Jeanette, in advance for your words of wisdom that I know would be incredible.
Thank you. Good evening. It is with great pleasure that I'm here tonight and at the invitation of Barb Baptista. Healthcare and health education has always been an important part of my professional life. So continue to do it at this point in my life is really an honor. Tonight we'll be discussing health disparities, why religious institutions should be concerned about health equity. This evening, to be inclusive, I will be using the word religious institutions, which includes churches, temples, mosques, and other places of worship and institutions that exist to support and manage the practice of a specific set of religious beliefs. And since we will be discussing health disparities, the US government defines health disparities as a particular type of health difference that is closely linked with social or economic disadvantage. These disparities negatively impact whole groups of people that are already facing significant barriers to maintaining good health, often because of specific social or economic factors, such as social economic status or income, race or ethnicity, age, sex or gender, geography, whether you live rural or urban, disability, sexual orientation, immigrant status, religion, mental health, and education. Historically, these characteristics have been linked to discrimination, don't have the same kind of access to healthcare, education, or healthy behavior. It can cause them to fall behind their peers on all kinds of health measures. These disparities can often persist for generations. So, how can we help? The mission given to the disciples is to preach, teach, and heal. And religious organization teaching and preaching has far exceeded her healing capabilities. Today's organizations have an opportunity in this modern age to be true to its calling. There are many tools to bring about healing. One of the tools religious organizations can use is a health ministry. A health ministry in a congregation does not replicate services that already exist in the community. It addresses health education more than illness. This kind of ministry has the opportunity to fill in gaps in health information, especially for teenagers, because certain health materials may not be shared in schools, and there are limitations as to what the local Department of Health can discuss in schools. So the church can have a ministry that fills in that gap. Religious institutions offer plenty of space for health professionals and the layperson to work together to keep people well, to empower them, to educate, to teach, to advocate for more and care for them. This is our job. This is our calling. Tim Wise said, if we don't figure out a way to create equity, and I mean real equity of opportunity and access to good schools, housing, healthcare, and decent paying jobs, we're not going to survive as a productive and healthy society, unquote. How is a ministry consistent with spiritual teaching? How is a health ministry consistent with spiritual teaching? How is it congruent with religious teaching? Let's kind of look at that. Religion, in almost every case, are concerned with healing the sick and the broken. Jesus was a holistic healer. He did not see a distinction between the body and spirit when he forgave and restored the sight. 20% of all stories about Jesus refer to his healing. The Gospels contain 35 references of Jesus' healing. Now, too often, today's teaching, we overlook them. We overlook a lot of the Gospels that refers to Jesus' healing. We must begin to be able to connect health issues and what is happening in today's world with our spiritual teachings. if we do not have that through line of that through connection, then it is just history, not lessons. And sometimes what is needed is a spiritual lesson as it relates to health and healthcare, not just historical facts. The Holy Spirit is always at work. The Holy Spirit is at work in the invisible workings of the body. Our job as medical professionals with modern medicine is to help create a space and a time for miraculous healing to happen. That's what we do. That's what we do with our medicine, and that's what the physicians do. They just create a space for miraculous healing to occur. What is the role of religious organizations as it relates to health disparities? Let us look at why we need to begin to earnestly discuss health disparities. The United States is home to stark and persistent racial disparities in health coverage, chronic health conditions, mental health, and mortality. These disparities are not a result of individuals or group behavior, but decades of systemic inequality in American economy, housing, education, and the healthcare system. Hopefully, the following information will shed light on some of the most persistent inequities facing people of color, especially African Americans or Black Americans, and why we must engage in conversations to help address these issues. Let's look at health coverage. In 2017, 16.6% or 11% of African Americans were uninsured, compared with 5.9% or 10% of non-Hispanic whites. 89.4% of African Americans had healthcare coverage in 2017, compared with 93 or 94% of white Americans. 44%, less than half of African Americans had government health insurance in 2017. 12.1% of African Americans under the age of 65 reported having no health coverage. Maybe, just maybe, this is why we see so many young Black males with hypertension, kidney disease, and diabetes. If they don't have health insurance, they usually don't visit the doctor until it's almost too late. According to the CDC, Black women are 2 to 3 times more likely to die in childbirth than their white counterparts, and are 50% more likely to go into preterm labor than white women. Black women are dying in childbirth at an extremely alarming rate. And the research I did, the cause is clear. It's racism. Doing all of my research, the word racism kept coming up. Racial disparities also happen in elementary school. Sometimes we don't think about health when we're thinking about elementary school, but disciplinary actions that can impair typical childhood development lead to academic failure and dropout and cause significant emotional and psychological distress, disproportionately affect Black children, multiracial Black children, and children from single parent homes. Racism in elementary school discipline can perpetuate disparities in today's educational and healthcare system. If a child drops out of school, more than likely, he's not going to get good health care. Some of the chronic conditions that African Americans especially face are 13.8% 8% of African Americans reported having fair or poor health, 13.8 or 14%, compared with 8% of non-Hispanic whites. 80% of African American women are overweight or obese, which leads to many health complications compared to 64% of non-Hispanic whites. We need to be talking more about these health issues in our religious institutions. In 2017, 13% of African American children had asthma, compared to 7% or 8% of non-Hispanic white. 42% of African American adults over the age of 20 suffered from hypertension, compared with 28%. Let's kind of look at that number again. 42% of African American adults over the age of 20 suffer from hypertension, compared with 28% of Hispanic white adults. Hypertension alone leads to many other chronic diseases. Mental health in 2018, 8% of African American adults received mental health service, compared with 18% of non-Hispanic whites. Now, when you look at that number, 8% compared to 18%, does this mean that we didn't need counseling? Or was it not recommended? Or was it not encouraged? 6.2% of African American adults receive prescription medications for mental health services, compared with 15.3% of non-Hispanics whites. In 2018, 3.34% of African American adults reported serious psychological distress, and I'm almost sure it's more than that. We're just not reporting it. 11.4% per 100,000 of African American men, and 2.8% of African American women die from suicide. We must, as a people, as religious organizations, we must begin to have conversations concerning mental health to help reduce the shame and stigma that we as a people have attached to it. The Nassau County Health Department has developed a referral guide that lists all the health agencies in Nassau County. And Starting Point Behavioral Health Care is listed. Starting Point Behavioral Health Care provides mental health and substance use treatment for residents of Nassau County, Florida, and surrounding Northeast Florida region. So there is a place that we can refer our community and our parishioners to. But our job is to help to take away some of the stigma so the people won't mind coming to you and saying there is something wrong that needs more than prayer. So remember where we can send our people. The leading cause of death among African Americans are heart disease, cancer, and accidents. African Americans have the highest mortality rate for all cancers combined compared with any other racial or ethnic group. There are 11 infant deaths per 1,000, not per 100,000, but per 1,000 live birth among Black Americans. This is almost twice the national average of 5.8% infant deaths per 100,000 live births. Health disparities adversely affect groups of people who has systematically experienced greater barriers of health based on their racial or ethnic background or other characteristics linked to discrimination or exclusion. For example, many LGBTQ people report having experienced some form of discrimination at the doctor's office, including the use of abusive language or denial of service. We as a group, we as a community, we as religious organizations must begin to advocate for all marginalized people, not just some, but for all marginalized people, because all people have health problems. And among people with COVID, Black, Hispanic, Asian, American Indian, and Alaskan Native patients have higher hospitalization and death rates than white patients. This pandemic showed the widened health disparities and further exposed the impact of social factors on health that were already there. It didn't expose something that wasn't there. It exposed what was already there. So we have a chance to actually look at it and do something about it. The conditions in which people are born and live should not determine the quality of their health care. It should never do that. Where I'm born or where I live should not determine the quality of my health care. For instance, policies that promote segregation in housing may explain why some neighborhoods have more uninsured or underinsured families. These families, in turn, may have less access to care. Why should it be possible in the United States? Why should it be possible that some people have a high risk of dying just because of where they live? Just because I live on this side and you don't live on that side. Why is that possible? Narrowing the disparity gap requires societal will. That means us. By driving policy changes that can level the playing field and make society more equitable. Health disparities do not only affect those facing them. I would remind you that we're all connected. We're all connected. This is something I used to say when teaching about HIV/AIDS education. People will be infected or affected by the disease. A community do not have to be unwell or poor to be affected by poverty or the economic impact of healthcare. Not addressing inequities, not assuring opportunities for the most vulnerable in our society harms all of us. We're all paying for the cost that this has had on our economy and our healthcare system. Did you know that racial health disparities result in 93 billion, that's with a B, 93 billion in excess medical costs, 42 billion in lost productivity each year. Working to close gaps in healthcare will take community and legislative efforts. But just as important are conversations we can have each day to raise awareness and point out injustice and advocate for change. As an individual and as part of a religious community, you can hold yourself accountable by being more aware of the problems and how your own attitudes and behaviors may perpetuate the problem. You can hold other people around you accountable by becoming an upstander or an ally of people from marginalized groups. John Lewis said, when you see something, say something. Speak up. Say something when you hear something that is wrong or offensive concerning other marginalized groups. When you hear something, when you see something, say something. People also can become involved in community endeavors and vote for policies who support equitable efforts. We should be committed as individuals and as community to helping make healthcare more equitable and inclusive for all people. So we're going to have to do more than just talk. We are. We're going to have to do more than just preach. We are. It might mean working with an organization like the Barnabas Center that provides primary care, dental, food assistance, financial assistance for utility bills, so people can store food and medication safely, or assist with rent so that they may not become homeless. Starting Point, who provide mental health counseling. Micah's Place is the only certified domestic violence center serving Nassau County, Florida, whose mission is to provide prevention and intervention service to victims of domestic violence and to provide education within our community to affect change in behavior and attitudes relating to domestic violence so that the cycle will be broken. Now, you may be thinking, did you know that 1 in 4 women experience domestic violence in their lifetime? One of those could be in your religious organization. One of those could be your family member. And you never know it because they don't come to you. We must be more open that they can bring this stuff to you. But even when they're open, you've got to know where to send them. We need to begin to partner with existing organizations. Do not reinvent the wheel. We have a lot of small organizations here in Nassau County. The health department is there. They can come out and do health education programs for you. Barnabas Center is there. Micah's Place is there. Starting Point is there. If you need somebody to come in and talk about mental health, you don't need a health ministry. We got people out there that you can partner with. We got many organizations can come and do health education for you. There's no excuse. I got 3 members in my church, so call somebody. Not say that we can't have health care for our people. Now, this sounds like a big problem. It does, and it is. But each person can do their part. If we all become a health ministry of one, if we all become a health ministry of one, we can make a dent in this problem. Thank you. Questions?
Oh, Miss Jeanette, very provoking. And if we could spend some time, and that has to do with a couple questions actually that I got here. If you mentioned about not reinventing the wheel,
Right.
where can my Bible church find where to find the right information to disseminate? That's one.
Oh, okay.
Right.
Are you asking the question? The question that, and I think I mentioned that. I think that every religious organization should have a copy of the resource guide that the health department is redeveloping. That resource guide will have all of the health organizations in Nassau County. So that if you have a client that you know is in domestic violence, it'll have Micah's Place. If you have a client that you know is having a mental health problem, it'll have Starting Point. If you want somebody to come out and do an educational presentation for you, call the health department. You know, we have agencies that you can call. You don't need to say, well, I don't have any health people in my church, so I can't have a health manager. Don't worry about that. You got a health resource guide that you can use to refer your people to.
And as a clarification, the additional information, that resource guide is on the Florida Department of Health Nassau website, and we are actually in the process of updating it. It is 2 years old. Yeah, the last time they were updated was 2020, and we recognize that there are several services that were not listed there. Some are new, some were just not in the radar screen, and they are. And our hope is to actually have that link to a referral system as well. So more to come on that. Next question. I recognize that my church has no control on healthcare coverage. So what can we do on ongoing basis to fill some of that gap on prevention?
You know, I like that. Well, prevention is first the key. Let me speak to that. The prevention side is making sure that you have health professionals, qualified health professionals, to come and do education service concerning different health issues. Now, if you know that half of your church, a lot of them had a stroke, I'm telling you, your message isn't getting to them. You're not preaching enough health message. Call someone, let them come in and talk to your parishioners about high blood pressure, about weight, you know, all of these things. Let somebody come in. Another point is, you say, well, they don't have health insurance. Well, I mentioned, and I can't speak for the Barnabas Center, so I want you to call them and find out what their guidelines are. But we as churches need to support the Barnabas Center, because half of your members who don't have health insurance, you know where they go? They go to the Barnabas Center. So you need to financially support the Barnabas Center, because that's where your people are going, the ones who don't have health insurance. So that's what I'm saying. They may not have it, because a lot of jobs don't have health insurance, but a lot of your members are going to the Barnabas Center. So we need to, that's why I said, don't try to reinvent the wheel. Don't do that. Link up with organizations that already exist. Link up with those. Barnabas Center needs more than food. They do. They help your members with lights. They help your members with rent. They help your members with dental. They help your members with primary care. That's what they do. So marry up with that agency so that your members who don't have health insurance, you can say, I'm supporting the Barnabas Center. So I don't mind my members going.
I wanted to thank you, Zavonia, for making a note that Baptist Health can assist with health education professionals for education sessions.
Very good.
And it's in person as well as webinars. Baptist has been outstanding with their monthly topics, very relevant to what we're going through, very clear. And I suggest you to sign up for it for the different sessions. If you don't know how to, we'll put a link there for, if you could please, Zavonia, put a link and how people find out about the sessions that you coordinate. That'll be very great. I wanted to also ask Zen Carver. Miss Zen, hope you're doing well. Could you rotate service through the day drop-in center? Can you talk a little bit about that? Share that list. Maybe you can put a little bit more information. Miss Walker is asking, do you serve outside Nassau County? Can a lot of our services, in particular the education sessions, we welcome our neighbors. Actually, Baptist and Nassau have done some joint efforts, and that includes Nassau County and Duval County. So as far as a lot of education sessions, we are very pleased to do that. And again, between the two of us, we are able to provide resources to you, or be able to come to your church with identify professionals that can come to your church if it's not one of our own professionals. Miss Jeanette,
Yes.
one more here. What's the best approach for me to talk to my pastor about doing something?
Okay, yeah. You know, let me say, if you, to me, this is only Jeanette, if you're already apprehensive about talking to your pastor, there's something, to me, there's something wrong with that relationship. If you're already apprehensive about talking to him about mental health, about domestic violence, about any health issue, then there's something wrong with that relationship. You might need to just talk to one of the deacons, pull one of them aside, or just tell him we need more health education in the church. You can be, it may not be about you. You don't have to say, this is what I want, but let's bring somebody in concerning mental health. Let's bring somebody in to talk about breast cancer. You don't have to tell them that I have whatever, but you can say, let's bring somebody in concerning that. But why I wanted to talk about this in broader terms is so that ministers will recognize, religious community leaders will recognize they have an important role in healthcare. That's biblical. That's not Jeanette. That's their job. That's their assignment when they became a pastor, to heal the broken. That's their job. Now, like I said, in today's society, a lot of that job is not being done, but that's their job. And I think we need to get back to that. If you don't have that through line between your text message, what you're preaching from, whatever text you're preaching it from, to whatever is going on in your church, or in the community, then it's only history. It's not lessons. If you don't have that through line that relates to some of the illnesses that are happening in your church, then it's just history. It's not lessons. So you gotta, I'm talking to ministers, you gotta connect what you're preaching about to what's going on in the world and in healthcare. You've got to do that. That's the only way we can save our people. That's the only way that we can do that. That's the only way that we can keep them healthy. A minister has a captive audience. He does, usually for an hour. Take that hour and help to heal the broken.
So you mentioned about the hour. Some churches have services in different times through the weekend.
Yeah.
Can the church be a host of activities, and what would that be?
What do you mean? Mention.
Let me see. That's what the question is here. Let me.
Oh, okay. The question is, can the church be a host of activities? I'm asked
Yeah, and what would there be on times that they are not having services?
Okay,
That's what I get it from here.
but just in case I'm understanding this, what a church can do is if on your prayer meeting night, let's say, so you don't bring people out more than once. Let's do on your Wednesday night. Have someone come in and do blood pressures. And while they're doing blood pressures, they can talk about hypertension, strokes, and heart disease. Have somebody do that. Then on your Wednesday, you can still have prayer meeting, but save some time so somebody can talk about some health issues. Another thing I don't see a lot in churches, put out health literature. It's okay. You can put out literature on heart disease. You can put out literature on diabetes. You can put out literature on breast cancer. It's okay to have a pamphlet holder with all kind of health information in it. You may not can talk about it, but you got the information there that if your people need it, they may not come to you, but you put it out there so that they will have it available to them. So that's another way. You may not have a health ministry, but you sure got the health literature up there for them.
We have a comment from Miss Zen. I will take all literature. So it's wonderful. Everly, we have the attendees speak, or can they only use the chat? Zavonia?
The chat bar.
Okay, thank you. So I would love if some of you, I'm very familiar with some of the work that you're doing with your church. Would you mind being part of giving suggestions to other participants on what your church has done to improve the health of your family members of your church or organization, faith-based organization?
Are you speaking to me?
No, I'm inviting others in the audience
Oh,
to
okay.
share
Okay.
their as far as post-COVID. Let me see if I understand that. Okay. There is a lot of people suffering after COVID.
Mm-hmm.
Any suggestions again about how my church can be of resource? And I think you actually mentioned that, Ms. Jeanette, if I
Yeah, okay.
again,
Let
about
me know
some
when
of
the
the
question is
resource.
for me. Let me know
Okay,
when the
yeah.
question is. Yeah.
Let me see here if we have some more questions. You talk about disparities on health. What are some of the disparities in terms of men's health? And again, what can my church do?
Well, it's the disparities in men's health are disparities like prostate cancer, all cancers. Let's say all cancers. There's a health disparity there with that. High blood pressure, there's a disparities there. So all of the health entities, there is a disparity there. So your church need to address all of the health issues. There's not one that you can say, I'm gonna address this and not this. No, address them all. Put out literature on all of them. Put out literature on prostate cancer. Put out literature on breast cancer. Put out literature on colon cancer. Put out literature on high blood pressure. Put the literature out there so that the people who need it can get it. Then when they have questions, then they can ask questions or you can refer them to someone. But if you got a church that they're asking a lot of questions about prostate cancer, you might need to bring somebody in to talk about prostate cancer. Because it's a lot of time most ministers, they may know the spiritual, but they may not know the physical. So that's when you partner and bring somebody in and talk about that issue. So if you got a lot of your members that have had strokes, you look out in the audience and you see members blind from diabetes or the legs cut off, you might need to bring somebody in to discuss that. Because your church is having a problem that may be not being addressed. So bring somebody in. You can look out in your audience and see some of the need, then bring somebody in to talk about it.
I'm looking over. Please make sure that you notice the information that Ms. Natasha McCoy shared from CDC on mental health. And CDC is a very reliable source for all of us.
Right.
Okay, there is a statement here. My church needs to address health issues. My pastors speak on health, but we need to be educated in health issue. I will become an ambassador for my church. All right. Thank you, Miss Lorraine.
Very good.
Yeah. Thank you very much.
Thank you. Yeah, what we need more is people to take the lead. We can be a ministry of one. Lorraine has already stepped up. She said, I'm going to be that minister of one who's going to carry this message. You don't need a whole group. You can be it. When you see something, say something. That's when you see it, speak about it. You can go to your pastor, hey, we need to discuss this. We need to bring somebody in and talk about this. When you see a problem, speak about it.
Yep. Perfect example. Oh, you both made my day with that. Let me see if there is any more questions here that I may missed. One just came in. I heard what you said about bringing a health topic in literature. Do you encourage us to have something on physical activity as well?
Are they saying literature on physical activity? I do. I would say that. However, let me mention this. Most health insurance, if the people got it, there is a health insurance, I don't have it, but it will pay for you to go to a gym. It will. A lot of health insurance will pay for you to go to the gym to do exercise. Now, if you don't have that, then you can just tell your parishioners to walk, but do something. One big thing I think we need to do is bring somebody in so that we can learn how to eat the food that we like in a more healthier way. It's not sometimes changing what you eat, because you might not be able to afford all the other stuff, but you might want to change the way you prepare what you eat. So you might want to bring somebody in to talk about that. When you look out in your audience and you see a lot of us, including me, who might be overweight, then you want to say, wait a minute, I need to bring somebody in about this.
Just in case is you not seen the chat, there was a statement and very true. Mr. Griffin mentioned Macedonia AME Church was very aggressive in getting our members COVID vaccinated and partner with a nurse from a health organization to vaccinate our members in February of 2020. Oh my God,
That's
I remember
right.
that. I
Yes,
remember
yes.
that.
Yes,
We
yes.
were all vaccinated early due to those efforts. And some of the church, and see, Jeanette, that can happen because there
Right.
were key churches. There were several churches that were key. They were instrumental in getting the number of individuals who are 65 and older and then 55 and older vaccinated.
Right.
We can do more. You
Yeah.
can do more.
We can.
Yep.
We can. We just have to partner with each other. We can't do it alone. Let's remember that. We can't. We have to partner with each other. We have to partner with agencies that are already out there. Again, I keep saying, don't try to reinvent the wheel. Don't try to do that. Partner with groups that are already out there.
Oh, Jeanette, I know you're not saying the chat, but you're going to be very pleased to see that Zen is already talking that they should partner with Lorraine.
Very
And
good, very good.
and Miss Burton, hi, thank you for being here, Miss Burton. It's an honor for us. May is Mental Health Month. At New Vision, we are checking on our church community, friends, and family, and it's often overlooked when we talk about health.
Yes.
I would love to promote your initiatives, Miss Kathy. Please, let's talk about it and see how other churches you can serve as example for other churches.
Very
Much
good.
appreciated. And let's see here. Yes, Jeanette is the best. Any other comments, suggestions? Any last minute thought, Miss Jeanette?
No, I just, whomever is on the Zoom, I really thank you all. I tell you for joining this, because this is something that we have to come together to solve. It cannot be solved by one church or one person. We're going to have to come together to begin to solve this. Well, it's whether it be with policy, whether it be with policymaker changes, whether it be with us coming in talking about different health issues, but we are going to have to do something to solve this problem. I have seen too many young men, less than 50, with who have kidney disease, high blood pressure, who've had strokes. There's something wrong. There's something we're doing wrong. Our message needs to be revamped so that we will capture, these people.
So any suggestions for us to, other than in a webinar, continue this conversation, Miss Jeanette? What can we do? What's the next step? What's next?
Well, the next step I would think is if churches wanted to begin to invite, I think they need to be more health education in churches. Most churches don't have a health ministry. So I really do think that they need to begin to invite health educators in so that you can discuss some of these health issues, so that they can ask questions. You can't hardly ask questions through a Zoom, but you're right there and you can ask questions. I think that's it. Coming up in the fall, my organization planned to have a luncheon for men, and Dr. Coleman will be one of the speakers that we're having in the fall and this is going to be on different health issues.
Mm-hmm. And remember, Baptist Health has a commitment to working with you as much as the health department. Ms. Avalie DeLay is our local contact for this wonderful organization. In Zavonia, because she leads all of this events that is open to everyone, I really encourage you to get in touch with Ms. Zavonia. And we have a small interfaith group going on here in Nassau County that I'll be very happy to talk to you about how to be involved with this group. So with in respect of our time, our evening, I'm going to be closing our questions and comments unless you have. I'm going to scan one more time to see if we have any
Can we do this again and invite churches who are interested in learning more about how to partner with Baptist Health?
Oh, that'll be
Okay.
wonderful.
Very good.
Emily, do we have any last minute notes? Nope. Okay. Well, thank you very much for being in attendance, and have a wonderful evening.
All right. Thank you.